Valentine's Day is right around corner, and whilst women may be expecting flowers, chocolates or something a little more special, one thing they don't want are health issues. At a time where many people will be spending time together, health experts have warned of sex-induced cystitis, which is estimated to account for around 60% of recurrent cases of lower UTIs. With the painful infection causing agony for millions, self-care in the bedroom is vital. To help people avoid this, women's health expert Dr. Catherine Hood from Meffercitrate has given an insight into the issue, as well as tips on how to reduce the risk, and how to soothe the symptoms quickly. Cystitis is very common, particularly in women, and most women will have cystitis at least once in their lifetime, and up to 1 in 3 women will have recurrent cystitis, says the doctor. Dr. Hood says that she gets many complaints from women who experience cystitis a day or two after having sex. Some have confided that they experience recurrent episodes which affect their sexual relationship with their partner, resulting in either abstinence or increased levels of stress and anxiety when having sex. According to a study, estimates show that sex-induced cystitis accounts for around 4% of lower urinary tract infections, UTI. This figure rises to 60% for recurrent cases, demonstrating that sex is a key trigger of cystitis for millions of women in the UK. So what is cystitis and what can you do about it? Here is what you need to know according to an expert. What is cystitis? Cystitis is inflammation of the bladder which can be caused by a UTI. It is a very painful condition causing burning pain when you pass urine, passing urine frequently, or having the urge to pass urine frequently. In addition to pain, there may be blood in the urine, or it may be cloudy and smell more or different from normal. You may also have a high temperature and feel feverish. What's the link between sex and cystitis? Cystitis is 30 times more common in women than in men. Women who are sexually active on average have 1 episode of cystitis every 2 to 3 years, according to a study published in the National Library of Medicine. This is because women have a shorter urethra, the tube through which urine leaves the body, and the opening is located very close to the anus. This makes it easier for bacteria present in the large bowel to reach the bladder and cause an infection. Join the Daily Record WhatsApp community. Get the latest news sent straight to your messages by joining our WhatsApp community today. You'll receive daily updates on breaking news as well as the top headlines across Scotland. No one will be able to see who is signed up, and no one can send messages except the Daily Record team. All you have to do is click here if you're on mobile, select Join Community and you're in. If you're on a desktop, simply scan the QR code above with your phone and click Join Community. We also treat our community members to special offers, promotions, and adverts from us and our partners. If you don't like our community, you can check out anytime you like. To leave our community, click on the name at the top of your screen and choose Exit Group. If you're curious, you can read our privacy notice. What are the factors that increase the risk of cystitis? Factors can include sexual intercourse, the use of spermicide, a new sexual partner in the last year, and the use of contraceptive diaphragms. As 90% of cystitis is caused by bacteria from the rectum, movements during sex help move bacteria up the urethra into the bladder. Movement during sex may also cause damage to the urethra, and this slight damage can cause bacteria to thrive and infect the urethra and bladder. When it comes to oral sex, bacteria can still be introduced to the urethra by the movement of your partner's mouth and cause an infection. Some positions can also have an impact. In particular, sex from behind can inflame the urethra. How can you soothe cystitis? To soothe the symptoms of cystitis, Dr. Hood says ether citrate tablets are a simple, drinkable solution to take. Available without the need for a prescription or a urine sample, the flavored effervescent tablets contain potassium citrate, which makes the urine more alkaline, helping to soothe the bladder and urethra lining and relieve discomfort caused by the infection. Can men suffer from cystitis? Yes, men can also suffer from cystitis. While more common in women than men, it can sometimes occur in men, especially those between the ages of 15 and 50, especially if they are sexually active, take part in anal sex and/or are uncircumcised. Cystitis in men is often a symptom of an infection, so they should see a doctor if it's recurrent. The risk of cystitis with any sexual activity is increased if you don't pee afterwards. If you are prone to cystitis, it's important to have a large glass of water every time you have sex to help aid in urinating after sex. What can I do to reduce the risk of cystitis after sex? Healthy self-care around sex is important, particularly if you suffer from frequent bouts of cystitis. Dr. Hood has shared her top 10 tips for reducing the risk of getting cystitis. Drink water. Have a large glass of water straight after having sex. It is important to drink a lot as this strengthens your pee stream and reduces the chances of bacteria managing to stick to the wall of your bladder and urinary tract. Effective hydration will generally make you pee more often, flushing the bacteria out. Pee before and after sex. Before and after having sex, go to the toilet straight away and empty your bladder. Wash down below. Wash your genital area before and after sex. This helps to keep any bacteria away from the urethra. Wipe direction. Always wipe from front to back. Doing so is more hygienic and will help you avoid spreading bacteria into your urinary tract and vagina. Take ether citrate tablets. If you have cystitis, take ether citrate tablets, which will provide soothing, fast relief from cystitis symptoms. Wear cotton underwear. Try to wear cotton underwear. This material is soft and allows the vagina to breathe. Try to avoid tight-fitting jeans or trousers too. Unperfumed. Avoid perfumed bubble baths, talcum powder and feminine wipes, as these can cause irritation. Diet. Eat a healthy balanced diet and include fruit and vegetables high in vitamin C. Avoid spicy or sugary foods and drinks, as they could make cystitis symptoms worse. Avoid sex when you have cystitis. Sex can cause friction and irritation in the urethra, which is sensitive during an infection. With penetrative sex, pressure on the vagina can also put pressure on the bladder and cause more pain if it is inflamed and sensitive. Seek medical advice. If symptoms of cystitis continue for more than a couple of days after treatment, see your GP, as cystitis can progress to a kidney infection which requires treatment with antibiotics. Don't miss the latest news from around Scotland and beyond. Sign up to our daily newsletter.